Craven County Board of Commissioners, we welcome you and thank you for your attendance here today as we gather as community leaders and citizens in this county to talk about an issue that definitely is on all of our hearts and our minds. You know, I was thinking about it when I first came on to the Board of Commissioners some years ago, and we started hearing about the opioid epidemic that we had in this county. We were not talking about some of the substances that are being used today. Fentanyl, I didn't know nothing about it. And we can keep on with the long list of things that folks are being addicted to. But I am thankful for those in this county that have rallied together and to try to do all that we can to save the citizens of this county from the drugs that they're faced with. Many families are affected by it. I mean, I think our Board of Commissioners go and they interact with folks on a weekly basis, and it never fails that you interact with someone that has been affected by substance abuse in some kind. This evening is a time for us to hear what's going on in Craven County, to hear your viewpoints, to talk about the plan that we have going forward with the funds that are coming to this county. And so again, on behalf of the Board of Commissioners, we thank you for taking your time to be here. And at this time, I'd like to introduce Mr. Tyler Harris, who is the RAI Community Collaborative Volunteer, who's going to come and say a few words.
Thank you, Mr. Chairman. It's nice to be here today and invited to talk a little bit about the subject as outlined. So I first wanted to tell you what about RAI, which stands for Recovery Alliance Initiative, which is a 501c3 nonprofit headquartered in the Piedmont of North Carolina. The president of this nonprofit is a gentleman named Tom Edwards, about my age. I'm native of Craven County from the Vance Spur area. The mission of RAI supports organizations from all sectors working collectively together that supports care related to prevention and recovery. RAI is no stranger to Craven County. In 2017, RAI initiated a summit here in this very building of some 130 people around, dealing in the arena of substance abuse and collaboration to better understand the subject and the situation. Then, on its heels, in 2017, 2018, the Craven County Commissioners initiated the Craven County Opiate Task Force, where they engaged 30 to 40 people dealing with it, studying it, committees, etc., bringing recommendations back to the county with the county manager, and then for the final study. At that point in time, the commissioners did enact a number of those recommendations. But wouldn't you know it, on the heels of that, in September 14th, 2018, what happened to everyone was Florence. And as you know, this building was 4 feet of water or whatever that it may have been, et cetera. So, you know, our community, our cities, our counties were all dealing with that issue. It was front and center. And then, Lord and behold, on the heels of once kind of getting through that after a number of years, COVID appeared, and everyone's attention was kind of in that genre as well. But now, because of Tom Edwards of RAI, he has secured a grant from the Department of Health and Human Services for Raleigh for 3 pilot counties in this state. One of those is Craven County, based on the reputation and interest of several dealing with the substance abuse issue. So again, I joined the effort being a volunteer for that initiative. So we have been meeting along with 30 to 40 individuals that are representatives from nonprofits and state agencies, individuals, elected officials, appointed officials, et cetera, on a monthly basis, and beginning to look at these issues and what we might do. So the idea of the initiative, one, is after putting this group together, was one, figuring out what resources do we have in this county dealing with substance abuse. What don't we have that we need? And thirdly, prioritizing that and finding a way to fund some of those initiatives. So what I'd like to do now is just turn our attention a little differently. I have just a few slides to share with you about the opiate situation that we have here in the state. So if I could have that first slide, please. This slide is an overall depiction of opiate deaths in North Carolina. Its source is the Chief Medical Examiner of the state of North Carolina. You can see from the bar graph below, it starts with the year 2018 and runs up through the partial year of 23. But you'll note a real spike in the year 2020 to 2021. The chairman already has mentioned one of those the main issue for this huge increase in suspected deaths, and it's fentanyl. Very, very deadly. A 29% increase as it started getting its legs, unfortunately, in this county, in the state, and this nation. Second slide. This one is from emergency departments in our state of overdoses as well. And you will note unfortunately, the pocket on the eastern area with Pamlico County, Craven County, Jones County, and then moving southwesterly, that's Scotland County, Richmond County, and the one north is Randolph. And then you have a pocket in the west with Caldwell, Rutherford, McDonald, et cetera. And then lastly, Swain County on the far west. Slide. So what that slide depicted was these counties, which are the highest rates of the opiate overdose from what emergency departments see in the counties and report. And yes, you see Craven as the 8th worst county in the state. And above it, you'll see Pamlico and Jones as well. Note the statewide average is 90.2, and we are double that in this county. These numbers obviously change up and down, but unfortunately, we stay somewhere in this 8th to 5th zone of deaths. This one, before I showed you the state, then I showed you the emergency department's hospital. This one's from the perspective of what EMSs see across this state. I will share with you that the population age for these overdoses, the largest elements are between the years 25 and 44 years of age. 19 years is the largest area for these deaths. And then the one after that is 45 to 54 years of age. Again, this chart depicts the slide we just saw from EMS as well. And Craven is the third highest on that, well over the state average of 122, more about 2.5 the times of that. And this slide again depicts Craven, unfortunately, as I said. So, in summary, it doesn't matter whether we're the 8th worst or the 3rd worst. It just shows a trend, unfortunately, where we are. We know we can't arrest our way out of this situation. I think our law enforcement is doing a great job, in my personal opinion, in the county, but it's going to take more than that. We have to collaboratively, together, find solutions. That's what REI has been doing along with others in this county, with the support of the Craven County staff as well. We couldn't do this alone. They're highly involved. So I think tonight is a good first step with this, in making those that are in this room more aware of what the situation is and beginning to find some solutions to the situation, which I know county staff and the manager is going to speak to. So thank you, folks, for letting me share.
Thank you, Tyler. I'm Amber Parker, the Human Resources Director for Craven County, but I do also oversee Craven County's Opioid Epidemic Response, the program formerly known as the Opioid Task Force. So that's one thing exciting. We do have a new program name. We are now referring to our program as the Opioid Epidemic Response. So our program started out very small in 2019 with one opioid task force coordinator and a community outreach budget to conduct the opioid prevention and education efforts. However, this program and its role is going to expand tremendously as a result of the national opioid settlement. To date, North Carolina's Attorney General Josh Stein has announced securing more than $47 billion through nationwide agreements with opioid manufacturers and distributors for opioid-related misconduct, such as failing to warn about the addictive risks of opioids, and also promoting and encouraging overprescribing through incentivizing physicians. The settlement funds are to help communities harmed by the opioid epidemic through treatment, recovery, harm reduction, and other life-saving programs and services. So where did North Carolina's portion of the nationwide settlements come from? You can see there's a graphic there, and it shows just how much money came. We've got 2 waves so far, and there is at least 1 bankruptcy and possibly more on the horizon. But you can just see the amount of money. So this is the money that's come to the state of North Carolina. And so overall, that's roughly $1.4 billion that is coming to the state of North Carolina over 18 years to support the state and local efforts to address the epidemic. And of that $1.4 billion, 85% is going to go to counties and to all 100 counties and 17 municipalities that have a population over 75,000 who joined the suit. And the state will keep 15% for their efforts. And along with that money, there is a document, and it's called a Memorandum of Agreement, and it's between the state and North Carolina local governments. And that document is what directs how all opioid funding is to be budgeted, how it's to be spent, and how it's to be accounted for, whether it's financially or also for impact outcome reporting. And that same MOA is going to apply to all of the opioid settlements, regardless of what wave, and also to the bankruptcies as well. So we all want to know, what about Craven County's share? So Craven County, based on our latest payment schedule, we are actually estimated now to receive $15.5 million roughly over the next 18 years. And you can kind of see a chart there that shows how that payment schedule is going to work, but an even more in-depth payment schedule can be seen here. The payment schedule is front-loaded to provide higher levels of funding initially, and then the annual payments will reduce over time. And the last payment is expected to be received fiscal year 2038, 2039. It's hard to even say those fiscal years at this point. And you can see the darker green bar at the very top of the payment schedule is the amount that Craven County has already received, roughly $1.1 million for fiscal year 22 23. So the MOA, that's really a big portion of what we're here to talk about tonight, and we've been learning a lot about it ourselves over the last several weeks, or really even the last year, little by little, but really getting more in depth with it now. It's a very lengthy and specific document, but in general, it has 5 broad requirements that all settlement recipients are required to abide by. And so those 5 requirements, the first, we must establish a special revenue fund, and this was done as part of Craven County's fiscal year 23-24 budget. And it's really important to note that it requires that funds can carry over from year to year, so we don't have to spend the funds in the year that they are received, but they cannot be commingled with any other funds, so this money has to be kept completely separate. We're also required to authorize spending ahead of time in a budget or a resolution, and the budget or resolution is required to specify some exact language where it has to say that this is an authorization for expenditure of opioid settlement funds. It has to say the strategy being authorized, the letter or number of the strategy from Exhibit A or B, the amount authorized for each strategy, and the period of time in which funds are to be spent. The MOA also requires that we understand and we follow options A or B remediation activities, and Jasmine's going to talk with you about those more in depth later in this presentation. We're required to follow all reporting requirements. We're required to submit all expenditure authorizations from our Board of Commissioners within 90 days. We are required to complete annual financial reports for each strategy funded within 90 days of the end of the fiscal year, and also annual impact reports based on each strategy that's funded within 90 days of the end of the fiscal year. The MOA also requires we hold at least one annual meeting where we are required to invite all municipalities in the county to provide input as to the proposed use of the settlement funds, and the meeting must be open to the public. Meeting this specific MOA requirement is why we are here today. Of course, we are not providing this program in isolation. We're part of many collaboratives, groups, and we routinely hear from our partners on program and service needs. This MOA is going to remain in effect for Craven County until 1 year after the last date on which any of the opioid settlement funds are spent. The last funds are projected to be received in fiscal year 2038-2039, so if they all happen to be spent in that fiscal year, the MOA will likely cease to be effective in June 30th of the year 2040. So the MOA, it offers local governments 2 remediation strategy options for counties to choose from. We can choose from a shorter list of evidence-based high-impact strategies that are listed in option A without any specific additional strategic planning required, or we can select from option B. And in order to select from that longer list of strategies offered in option B, we must first complete a very specific 14-step collaborative strategic planning process that's outlined in the MOA's Exhibit C. It has a lot more exhibits than that, but I won't go through them all for you today. But we did provide a link in the PowerPoint, which I'll email out to everyone after this session, and that way you can look more in depth into these resources if you like. So I'm going to invite our opioid outreach coordinator, Jasmine Kennedy, to talk to you more about the MOA options A and B related strategies.
Evening. I'm short, so I'm scared of heights, so I had to come down here to the floor. So as she stated, the MOA is divided into 2 options, and I will be referring to the options document that was at the registration table in case you guys want to follow along, and if you wanted a copy, Ms. Lauren has some copies right here. So we're going to get started. So under option A, we have strategic planning. For the first strategy, I know some of you are thinking that strategic planning was listed under option B. You're correct. Strategic planning is listed under option B, but however, we can strategic plan while we strategic plan. So you can opt for option A as well as option B and participate in strategic planning as well. Second, we have evidence-based addiction treatment. And what we're referring to with evidence-based addiction treatment is we're referring to medication-assisted treatment, formerly known as MAT. And that's your methadone, buprenorphine, and naltrexone medications, which are all approved by the FDA. The key words to this strategy is evidence-based. It has to be an evidence-based practice for opioid use disorder specifically. Next, we have recovery support services. This can include funding for peer support specialists, care navigators, case managers, or any related resources that support or connect individuals to services. So those are your daily recovery support services. Next, we have recovery housing. Funds can be used to support programs that offer housing for individuals that are in treatment, recovery, or that are receiving MAT, and these funds can be used to assist with rent, utilities, deposits, application fees, or any other fees that are related to housing. Next, we have our employment-related services. Individuals that are in treatment and recovery often face barriers to employment and getting a job. So these funds can be used for job training, resume building, interview coaching, transportation to interviews or to work, clothing, or any other resources that helps those individuals get back on their feet and getting employed and staying employed. Next, we have our early intervention programs. These programs are initially focused on the prevention side. So we will be able to fund programs and services that encourage early identification and intervention for children or adolescents who may be struggling with problematic use of substances or mental health conditions. And that can include mental health first aid, or if you wanted to collaborate with our school districts and providing prevention education. Next, we have naloxone distribution. Naloxone, some of you guys may know that as Narcan. It's a medication that is used to reverse an opioid overdose. We will be able to purchase Narcan and distribute in the community, whether if it's with the health department or to municipalities, first responders, or any community-based organizations. Next, we have our post-overdose response teams. Post-overdose response teams are teams that reach out to an individual approximately 24 to 72 hours after a reported overdose or a Narcan administration. And the goal of that interaction is to connect them to services. Even though individuals may not be necessarily ready for treatment at the moment, but they will be provided with naloxone or syringes or any other harm reduction materials that they may need in that present moment. Next, we have syringe service programs. Syringe service programs are programs that provide safe use materials such as syringes, naloxone, fentanyl test strips, or any other harm reduction supplies that keeps those individuals safe while they're actively using in the event that they are not ready for treatment. They also connect individuals to treatment that are ready for treatment, but the main goal of the syringe service programs is to prevent further harm such as diseases like hepatitis. Next, we have our criminal justice diversion programs. We often refer to these as our pre and post arrest programs, where we connect individuals that are at risk of incarceration to services and or treatment. So instead of arresting them, we would connect them to services or treatment. Next, we have addiction treatment for incarcerated individuals. We've seen that language of addiction treatment before. Again, that's referring to medication-assisted treatment with buprenorphine, methadone, and naltrexone, and that would be for individuals that are incarcerated in our detention center or prison. And lastly, we have our reentry programs. Funds can be used to support our reentry programs. That's where we will meet individuals right there as they're getting ready to be released from the detention center or getting ready to be released from incarceration, and we will meet them right there and immediately connect them to the services that they need, whether if it's housing, transportation, employment related. We meet them right there at the door and get them connected to what they need. So that's option A, and so we're going to move along to option B. If you guys have a MOA document, you're going to see that option B looks a lot like option A. And some of you may be wondering, well, what is really the difference between option A and option B? Option A is our don't reinvent the wheel strategies. Option B is more so of us searching for innovative ways to practice those previously listed strategies that will require a community collaborative strategic process. And so we're gonna go over those, and they're broken up into 3 categories. You have your treatment category that consists of treating opioid use disorder, supporting people in treatment and recovery, connecting people who need help to the help they need, address the needs of criminal justice involved persons, address the needs of pregnant or parenting women and their families, including babies with neonatal abstinence syndrome. Under prevention, we have prevent overprescribing and ensure appropriate prescribing and dispensing of opioids, prevent misuse of opioids, prevent overdose deaths and other harms, which we call harm reduction. And then lastly, under other strategies, we have first responders, leadership, planning and coordination, training, and research. Sure, yeah. Absolutely, and your MOA goes through that. Yes, sir. If you look in your MOA packet, option B literally has an explanation of all those strategies under option B. Yes, Commissioner. We are required to track the impact and success. That is a part of our reporting requirements, if I'm correct. Do we have a for sure plan or layout of how to?
So I would say if you take a look at the data that Tyler presented, where it looked at the number of overdose deaths and the number of overdose-related ER visits over time, you could say that it looks like the problem is getting worse. Now, it's very difficult to know for sure. Is the problem getting worse because less people are using but more people are dying, or are more people using and the same number of dying? So it's very difficult to sort that out. But in general, we are keeping track of our program outcome data, the number of events that Jasmine goes to, but whether we can say 100% for certain if everything we are doing is making less people die compared to the number of people using, that we don't know.
This young man just gave me a mic, and my preacher said, "Don't do that to me." My question is, with the folk that we've worked with, do we have any that are now free of drugs and moving on, having successful lives? I think that is what I'm really trying to determine, what I'm asking.
Okay, yes, we do. And so we learn a lot about that when we're part of the RAI collaborative Tyler mentioned, where we all meet together and we hear from people who are in the service industry, and often they're bringing in some of their clients who have success stories to share. Now, one area where we've noticed that there is a gap, and that I think statewide we want to work on, is something that is like a continuity of tracking. So what happens is once person leaves one program, they go into the next program. Well, the first program isn't tracking them throughout their treatment process from beginning to end. So that's one of the things that we want to look at. And the MOA is going to actually require that not only do we report on quantity outcomes, like the amount of things we're doing, then they want us to show the quality of it, how well we're doing it, and then we also have to show the impact, what difference are these efforts making. So as we put these programs in place, we're going to have to really do a lot more work to make sure that we're recording all of those outcomes. But that is one gap that has been identified right now, is that there's really nothing that's capturing a person's success or failure in these treatment programs, especially because of some of the boundaries of HIPAA where they can't really share patient information. So that is one thing where we do need to work on that.
Yes, sir.
Organizations that help right now with some of these specific items. Can any of this funding help those existing organizations?
Absolutely. If you look at the tippy top of that document, it will say fund or support. Those words will be in quotation marks.
Excellent.
So we will be able to fund new programs as well as support existing programs.
Good. My other question was, there's an organization in Havelock. I had a conversation with her a couple months back. She was talking about a Narcan vending machine. Is that something that you're looking at to bring to the area?
Well, Narcan naloxone distribution is on option A, so that
But
could.
the actual vending machine, is that even?
I don't want to tell you yes and I don't want to tell you no.
Okay.
But it is part of naloxone distribution.
Okay.
So
Because I know there's an organization asking about it, and since this came up, I just wanted to ask you about that.
absolutely. I mean, it probably would follow under naloxone distribution. So. All right. So we'll go to the next slide. So we'll go over the current opioid remediation strategies that we have currently. As Amber stated, they hired me in 2019 as the opioid task force coordinator. We also have community outreach and prevention efforts that are ongoing. We have recently created a jail navigator position that is in our Craven County Detention Center. We have Narcan naloxone distribution in a community. We have Realize You 252 sober living facility, as well as Reviving Lives Ministries. We have REI, community collaborative participation. We have the DITS Crisis Center down there in Jacksonville, Onslow County. We have treatment and recovery related transportation provided by CARTS. And we have created additional narcotics investigator positions. And we have funded and supported K-9 and DARE programs, as well as Hope Mission Ministries. Okay. I will pass this on to Jack. Thank you.
So I get the easy part here tonight, which is really to learn from you about what Craven County can do to help meet your needs. I will tell you, as Jasmine was going over some of the statistics, there's always one that stands out to each individual. The one that stands out to me is if you read our social service report every month, you'll note that our DSS director puts a little statement on the first page about how many children were born with drugs in their system. Last month, that number was 9. 9 infants, newborns, with drugs in their system. The likelihood of that child's success in life is already reduced at that point, and something that I really get kind of caught up on from time to time. So it's going to be really hard for the municipalities to hide from me today because there's only 2 of you here, so I can see both tables. So I'm going to start with New Bern because I'm looking at Alderman Brinson here. Talk to us, Assistant Manager and you, what are some things we can do to help New Bern with some of the challenges you have here in the city? Right.
Having the ability to partner and receive some funds for that, I think, is one of the things, because I know we go through a lot of those,
Sure.
Unfortunately, and that would be the first ask that we would have for you all.
Gotcha. I think we can help you right away with that one. I think we got some Narcan last week, if I'm not mistaken. So, I will say something nice about New Bern. You can put this on the record. I'm really impressed with your program, with your co-responders, with your police department. They have mental health first responders out there. I've heard a presentation through REI, through Tyler, actually invited him to come, and it sounded like a great program. So, hope you got a lot of success with that. So, anything, Alderman, to add, or kind of work with you, work with the chief on that? And sure, understood. Gotcha. Friends in Havelock, I know we got 2 folks here. Anything we can help you guys with? Any issues, concerns you may have?
I believe it's the same, the Narcan.
Sure.
Just for the police department last year, we looked at some stats, and just the PD alone, we used over 70 doses, just ourselves in Havelock. And I mean, that doesn't even count the EMS side.
Right.
So unfortunately, we do use our fair share of it, unfortunately. I'm big on organizations. If anybody knows me, and I know these two gentlemen do, you know, our National Night Out program. So I'm always inquiring about organizations. So that's why I asked those other questions, you know, how can this help those organizations? I believe Exhibit A hits the nail on the head with the different steps to help these people. And Mr. Harris, you said it best, and I've mentioned it before, you cannot arrest your way out of this. So, I mean, Havelock is definitely in full support of this and whatever we can do for that.
Gotcha. And you know, one of the things you mentioned Narcan, both of you did there, and before we get over to Chief Dorn, one of the challenges is it used to be one Narcan dose was enough, right? Now we're looking at the report, it's multiple, not just one, not just two, it's multiple uses of Narcan, and that really burns the supply. It's not gotten any cheaper, and it's not any easier to get. So, Chief, anything to add, or?
Increase bandwidth with Jasmine. Narcan is, yeah, obviously we're going to get that. If we can push that down to the rescue squads, build out some collaboration so that we can stop the bleed, right? Keep them alive so that we can get them into rehab programs and treatment programs. That'll be the first step. So, and while I got the mic, I'd say Jasmine's reputation has preceded her, so she's doing good.
Good job. Thank you. Okay, we look at our Craven County team. Commissioners, any comments, any thoughts? I know we've talked about it a lot. Commissioner Hunt, Steve, we need.
Can someone explain what youth mental health first aid is exactly?
I might have to look down the line there.
So I just actually became certified in adult mental health first aid and as well as youth mental health first aid. And what it is say if you're having a bad day, right? We're at work, right? And you haven't been yourself, you're not your your usual giggly self. Basically, I have the skills to engage in that conversation, to basically see what's going on with you, to see your current mental state and offer whatever services that may be available to you. It's more like first aid. Again, I can't treat or diagnose you. I can't say, well, that sounds like bipolar. It sounds like you're depressed. I can just say, hey, well, it sounds like you're going through. Here are some services that are available to help you get through this time.
And just to add to that, basically what it is, just like we have first aid for physical injuries, it's first aid for mental injuries.
This is not directly in answer to your subject, but you mentioned youth. And, you know, we really need to devote efforts for preventative measures with our children. That is one of the biggest things that we could do, is programs that would help to educate and hopefully prevent this situation.
Which leads me to my next question about the DARE programs. I understand it's either, I've been told 4th grade, 5th grade. We need programs in the middle school and high schools. And do you have plans for that?
So let me, if you don't mind, I'll take that one. So, Commissioner, we're so dependent on the school system, right? We can only help them and offer the resources, but it's up to them on what programs they'll allow to come in the schools. Chairman and I and Vice Chairman have had that conversation with their leadership. The ball's in their court. I do know that Jasmine and some of her team have worked with folks there, but to get the holistic approach, and I think Mr. Harris has spent a lot of time dealing with that as well, really we need to hear from them what they need. Very good.
I would just add to that, I think it needs to be in the middle school and high school. And my last question I have for right now, could you explain your syringe replacement program that you have planned? Are you going to be doing it at the health center, at the...
Ma'am, let me just, so those programs there were only options. Those are not programs that we're creating. So I want, for the record, those are the different options under A that we can choose from. The board did approve some initial funding items. One of the big pieces this year is post-overdose response, and we're partnering with Carolina East. I think I can say that now because we've gotten through the budget process. Carolina East will do that 24 to 72-hour program that Jasmine spoke about earlier. And when those things are identified as needs, there will be resources that they'll have at their disposal to deal with them on an individual basis, right? So, but that list is not what we're doing. That's what we could do. Yeah, and I mean, where Havelock does have they have a program there. Sorry, I should have.
No, you're fine. The program you do with the hospital, is that community health paramedic that's going out posts?
It will be
Or-
it'll be a county-wide post-overdose response team. I don't know. I think community health is sort of on the boundary. I don't feel comfortable saying that's exactly what it is, but they'll have some certified professionals that will get the reports from EMS or other means, and then they'll follow up with that. We're really excited about it. That was the big piece of the puzzle this year, and we presented that to commissioners, is getting that program in, because we can identify the folks that are in that crisis. We might have the tools through Jasmine and her team to get them in the right path. That's right, peer support specialist. Thank you for that. I lost that word. Mr. Howard.
I'll just add to what Sherry was saying. As someone who helped write a grant last year for a DARE program in a middle school, I think that the prevention part of that, because I've seen in the last 10 to 15 years a mentality that's went from just say no, which I know is a little antiquated and maybe not the exact program we want, to a program that's evolved to no program in many middle schools, or an attitude among adolescents that is kind of like, that's just a choice I have if I want to do drugs, or I want to smoke marijuana or weed or whatever they call it. That's a choice I have. And we have, people selling it. They have it in vapes now. They import it from other states illegally. And there's just nobody there saying this is a bad, teachers say it, but when you have a law enforcement officer in there, your SRO, with that DARE program, it makes a huge difference from what I've seen, just in the mentality that these kids have, and seeing what happens when you do get addicted to drugs.
I know the sheriff's very enthused about the DARE program. That was one of his initiatives. I believe it's in every elementary school this year, and then I'm pleased to hear that the middle school is an option next year. That's good.
Just a question, I guess, for Jasmine. When you were talking about the syringe service program options, you mentioned test strips. Is that for fentanyl or what?
Yes, sir.
Okay.
Fentanyl test strips or drug testing strips, but formerly
Right.
known as fentanyl test strips. Yes, sir.
And so my idea, the curiosity, and I'll defer to our first responders, was if that would be useful to have test strips for them in case they come across some of those substances in an EMS situation or in a first responder situation, something like that would be something I'd be interested in asking the question about.
Gotcha. They're certainly on the list. I know part of the post-overdose response, that's something that's part of that program. But yeah, certainly if you guys think that's something to be useful to you, I'm sure Jasmine could get some for you. I know that's a tough deal. Anything in the back, Steve? Mr. Mark? Mr. Smith? There we go.
I have a question. I know that we said earlier, and I agree, that we cannot arrest our way out of this problem. However, considering that we are one of the counties with a large number of people who are suffering and dying, are we looking at ways to find out where it's coming in, how it's coming in, so that we can solve that problem? We can at least address that issue.
Right. So I'm not a law enforcement officer, so I'm probably not qualified to say it, but I'll give you my best shot, and we certainly have one in the audience. If Sheriff Hughes were here, he would tell you there's some national narratives about where it's coming in, and we need to be mindful of that. But also, I think when we pull up the screen of what we've already done, investing in undercover narcotics officers, additional investigators, and canines, help do the best we can. I do think back, Commissioner Booker, and I look at you, because we sat in a room a year ago, almost, in Concord, and we were talking, listening to the war on drugs, and there was a statement that the guy made that you're never going to arrest your way out of this problem, right? So we have to come to that reality first. and we start looking at these tools, and I think we got to keep making a dent, and I think we are, but it's never going to be enough. It's never going to solve the problem. Hope that answered it. Any questions? We do have a citizen in the back. Yes, ma'am, please. He'll bring you a microphone here.
Eventually going to be put in place to some type of counseling for the family members that are going through this with the ones that are addicted. Something put in place for the family members because they go through that as well.
Understood. And that's the part that gets missed in this a lot is what the family goes through. And we talk about providing help not only to the individual but to their family. I'm going to look to Jasmine and Amber on that piece. I'm not comfortable enough to answer that one.
And I'm not in a position to answer that question. But certainly there are support groups out there. We do have AA, NA, we do have Celebrate Recovery in various areas in Craven County that are open to family members. So there are options out there for support groups. Hopefully as we get it, this is an 18-year process for us receiving funds. So hopefully in the years to come, we will have more options for families because as we know, addiction does affect the families as well. So while we don't have a lot of options available now, hopefully in the long run, as we go along this journey, there will be more support services for the families specifically.
Just one other answer to that. RAI, this nonprofit, with the help of all these organizations through the collaboration, is putting together a very comprehensive directory of the resources, not only in this county, but in the state as well. And I would also tell you that a phone call to the county office as well can really be the resource for helping folks know how to begin and where they can begin.
Anything else? Mr. Chairman, anything?
I think I just want to say, I think on behalf of the board, we've had a lot of discussion over the last year. Former Chairman Mark, Mr. Mark, he was a leader in helping us start this discussion on the opioid epidemic in this county, and from that, you know, we have had a lot of folks to be a part of further discussions. I just say thank you to our panel there for all that y'all have done in your preparation. And definitely, you know, as we go forward, as Jasmine just said, there'll be things that we'll be adding. That's why we're here tonight, to hear from the citizens, from our municipal partners, and things that we can do for the future. And so, so we are a work in progress, if you want to say. And so we need for folks to continue to share with us their ideas as we go forward. So thank you.
Thank you, sir. Commissioner Booker, I didn't mean to skip over you. Jeannie, have anything to add, sir? Well, we're not going to keep you here any longer than we have to. I want to thank you for being here as well. And I think as the chairman just said, this isn't the end. This is the start. As Amber noted, we'll be here with you every year through 2040 to do just this. And hopefully next time there'll be more municipal representation. But what we want you to understand is if you have a crazy idea, you come into work one morning and said, I wonder if this is possible, call us. Maybe it is. We're going to work with Mr. Harris. Right now we're limited to A. We do have to do a 14-step process. 14 steps is 13 steps too long in my mind, but we're going to do it anyway. And we want to open up to all the options that we have and look forward to working with him and his team about that. But please call us. Please pass along these messages back to your organizations. And again, thank you for being here, and we'll see you next year.